Good day, everybody. This is Chris back with the Ancient Scholar, and hopefully you all had a great spring break. If you were able to take a break, and if not, well, happy Monday nonetheless. So today, what I'd like to talk about is a relatively common area of toxicology. And by relatively common, I mean not as common as things like acetaminophen or salicylate overdose, but it is still something you run into time to time. So I want to go ahead and talk about that, and that is the toxic alcohols. And to understand the toxic alcohols, what I want to do is I just want to briefly talk about the common type of alcohol that people are used to, and that is ethanol. That is ethanol, and some people abbreviate that ETOH, ethanol. And when we talk about alcohols, basically what an alcohol is it's a hydrocarbon with a hydroxyl group attached to the end of it. That's the basic structure of an alcohol. So that can include many different types of organic substances. But there will be three that we'll talk about today, and I just want to go ahead and briefly talk about ethanol and ethanol's metabolism, because it will be important to understand how that process or the enzymes involved in ethanol metabolism can affect the toxicology of the other alcohols. So ethanol, ETOH, all right, the chemical structure of ethanol can be abbreviated in a couple of different ways. There are a couple of different ways that people abbreviate that, and they're all basically the same. You can do CH3CH2O2 is one way of saying it. Another way of saying it is C2H5OH, and some people will even say C2H6O. Either way, when we look at the basic structure of ethanol, it looks like this. Pretty typical hydrocarbon. All right, so there's your CH3, you have your CH2 here, and then you have your hydroxyl group at the end, and of course this hydroxyl group is what makes it an alcohol. All right, so now that we have that out of the way, let's go ahead and just talk about the metabolism of ethanol. Ethanol, or the common drinking alcohol, is metabolized through three different pathways. There is the major pathway, which involves the enzyme ADH, alcohol dehydrogenase. So I'll just draw that here. So alcohol dehydrogenase in human beings is an enzyme that is a major enzyme involved in phase 1 metabolism, but it is not a cytochrome P450 enzyme. It's actually one of the guys that is involved in phase 1 metabolism, but it is not a CYP450. So it's kind of a unique enzyme. In fact, it doesn't even use, at least in humans, it doesn't even use iron as the metal for coordination. Alcohol dehydrogenase commonly uses zinc to transfer electrons around. So that is puts it kind of in a class by itself. But it does involve the same NAD molecules that we've talked about before, as far as NADs shuffling either shuffling protons or electrons around. So you also have to feed NAD plus in here, and then NAD will take hydrogens away, and it will become NADH plus a proton. Okay, so ethanol is metabolized by ADH, or alcohol dehydrogenase, and it becomes, at the end of the day, CH 3CH double bond O. You've lost some hydrogen there. And this is acetaldehyde. And I'll just go ahead and write that up. Acetaldehyde. All right. So that's the major pathway. And I think what I'll do is maybe I'll just make a different color for another pathway. And this is actually a pathway that does use cytochrome P450 enzymes. So this yellow, red, pink color here denotes the CYP pathway. Specifically, it uses CYP 2E1. CYP2E1. And this pathway is also inducible. And that is to say that in the setting of chronic exposure to ethanol, there will be enzyme induction, and this pathway will become more prominent as the person develops tolerance to the ethanol. The ADH pathway and the other one that I'm going to talk about are typically not considered to be inducible pathways. Okay. So the cytochrome P450 enzymes, of course, typically use NADPH. So NADPH here plus 1/2 O2. All right, and so that enzyme is involved in some electron atom shuffling there, and it comes off as NADP plus a water molecule. Okay, so that is the inducible pathway, and then there is a third pathway, and we'll just choose a completely different color. And this is very minor. This is considered a very minor pathway, the use of catalase enzymes. All right, catalase enzymes. But all three pathways kind of go to the golden brick road, and that is the acetaldehyde. Now, from there, acetaldehyde is going to be metabolized ultimately into acetic acid, which then can be eliminated fairly easily through the kidneys. So the enzymes are going to be just a little different in this case. Instead of alcohol dehydrogenase, what we're going to have is we're going to have an enzyme, and you know what? I'll just go ahead and draw it here. We're going to have the enzyme ALDH, which is aldehyde dehydrogenase. Okay, and ALDH is going to do pretty much a very similar thing as alcohol dehydrogenase. It is going to use NAD plus, and it is going to do the same thing, NADH plus H plus, NADH plus H plus here. All right, and that is ultimately going to metabolize the acetaldehyde into acetic acid. Acetic acid. And acetic acid is just CH3COOH. All right. There is also a pathway that is also inducible that involves CYP2E1. Okay, it's the same pathway. All right. And I'm just going to draw the same thing here. All right, I'm not going to draw it all over again because it's the same thing happening up here. And of course, you're also going to have catalase enzymes. All right. And at the end of the day, it becomes acetic acid. Now, what I want you guys to focus on is actually right up here with alcohol dehydrogenase. Alcohol dehydrogenase, and to some extent, aldehyde dehydrogenase are going to be very important enzymes when it comes to the toxicity of what are the so-called toxic alcohols. So keep that in the back of your mind. All right, so when we talk about the toxic alcohols, they have the same alcohol structure as ethanol, and they can cause intoxication just like ethanol. So the ataxic gait, the inebriation, All of those things, those signs and symptoms, can be produced by the toxic alcohols. But the reason that we call them toxic alcohols, because all of the alcohols are toxic. Ethanol is toxic. It has central nervous system effects. It can produce toxicity. It can be fatal when overdosed in large amounts. And of course, there are chronic issues associated with ethanol. So it is no doubt toxic. But what we mean by toxic alcohol is that these have some special or some unique toxicities that go above and beyond the standard intoxication that we see with your ethanol. The two big toxic alcohols I'm going to talk about today include methanol and ethylene glycol. Methanol and ethylene glycol. All right. So I think what I'm going to do is I'll just talk about them individually, and we'll start at methanol. All right. So we'll start at methanol. Methanol has a chemical structure that's very similar to methane, as you might guess. Okay. So you have your carbon, you have your C3H's, and then one of those H's is just an OH. All right. So that's your methanol. Now, methanol is no more toxic than ethanol. Okay, so methanol by itself is not toxic, and that's something to know, that the toxic alcohols are inherently non-toxic. They work like prodrugs, however. They are metabolized into toxic metabolites. So let's just talk about how methanol is metabolized. So methanol is metabolized using the same enzyme, alcohol dehydrogenase, all right, and you've got your NAD here and NADH, all right, there should be nothing new there, okay, and what happens is methanol is ultimately metabolized into formaldehyde. So let me write that here. All right, it's metabolized to formaldehyde by alcohol dehydrogenase. And formaldehyde just has a structure that looks like this. See, there's a double bond O there. And then I believe just a hydrogen. There we go. Just a hydrogen there. Okay, that's formaldehyde. Now, formaldehyde will be metabolized by the enzyme ALDH, aldehyde dehydrogenase, all right, and it will be metabolized into formic acid, all right, so down here it will be metabolized into formic acid, which of course formic acid, when it dissociates, can become formate, the formate ion, okay, which looks like H, C, double bond O, and then an O minus, okay, because it's an ion at that point. And then formic acid is just going to look, well, it's going to look very similar to formate. It's going to be H, C, double bond O, OH, all right. So you have formic acid, you have your formate, and here's the problem that we get. Here's a problem that we run into here. Let me just make this a different color. Formic acid, it can, because it's acidic, it can cause a pretty significant metabolic acidosis. And in some cases, this metabolic acidosis may not be associated with a lactate. Okay. May not be associated with an elevation in your serum lactate, which is somewhat unique. Now, the problem with formate is that you need folate. Okay, so ultimately, folate helps break formate down into CO2 and water. Okay, but the problem with formate is highly toxic to mitochondria. Highly toxic to mitochondria. Specifically mitochondria of the optic nerve. So the special toxicity that we can see occur with methanol, which is also known as, I should say, it's also known as a wood alcohol. And it's not uncommon to find this as an adulterant in wines, beers, whiskeys, things like that that people homebrew. It's not uncommon to find that as a contaminant or adulterant of homemade alcoholic beverages. So the formate is toxic to mitochondria, specifically mitochondria in the optic nerve, and so this is associated with significant visual impairments, and people may develop like a staticky snowfield vision, and among other significant visual impairments. Why this tends to be specific to mitochondria in the optic nerve, nobody really knows. There really aren't any good, there's not a good understanding of why it's specific to the optic nerve and not mitochondria in other areas of the body. That's hard to say. We just know that that's where it acts. So those are the specific toxicities associated with methanol overdose. Let's go ahead and just move over and talk about ethylene glycol. Ethylene glycol is very common, very common in your older radiator fluids. Your toxic radiator fluids is where we see ethylene glycol toxicity. It has a very sweet taste to it, so it's not uncommon for kids and animals to really like this stuff. So ethylene glycol is has a bit more of a complicated structure. It looks like this. So you have a hydrogen, you have your two carbons, just like you have an ethanol, and then what you have is you have two hydroxyl groups that come off of the carbons here, OHs. All right, and then you have your standard hydrogens here, and then a hydrogen. So your hydroxyl groups are up here. Okay, so that is ethylene glycol. All right. So ethylene glycol is also metabolized by alcohol dehydrogenase, ADH. Okay, ethylene glycol is metabolized, and of course there's a whole NAD thing going on there, NAD plus thing going on there. It is metabolized into glycoaldehyde. Glycoaldehyde. Which is a molecule, I believe, looks like this. You still have your main there. You just have a double bond to an oxygen here, and then you have a OH group, a hydroxyl group here. Okay, so glycoaldehyde can then be metabolized into a couple of different molecules. Okay, so I'll just draw two different little pathways here. This pathway here involves ALDH, okay, aldehyde dehydrogenase. That should come as no surprise because this is an aldehyde, it's glycoaldehyde. Obviously, ALDH also has a little NAD thing going on there. And this is metabolized into glycolic acid. Glycolic acid, all right. And you also have a pathway over here where I have glyoxal produced. All right, glyoxal produced, and then you can have a couple of different enzymes involved here. You can have a lactic dehydrogenase, 2, 3, we'll just put a few dots there, lactic dehydrogenase, or glycolic acid, oxidase, so glycolic acid oxidase. Okay, those enzymes are involved in the metabolism of these guys here, the glycolic acid and the glyoxal. Ultimately, that produces a molecule of glyoxylic acid here. Acid here. All right. And boy, if it doesn't get even more and more complicated. So there are three things that can happen to the glyoxylic acid. The first thing involves thymine. Okay, involves thymine over here, and this produces a molecule of alpha hydroxy. So alpha hydroxy beta keto adipic acid. All right, so that's one pathway. The second pathway, okay, involves pyridoxine right here. In E, pyridoxine, and that produces oxalic acid. Oxalic acid over here. And then I have a third pathway involving magnesium and benzoic acid. Benzoic acid over here. And this ultimately produces hippuric acid. Hippuric acid. All right. Oh boy, that's a whole bunch of stuff. The major of these three metabolites, the one that I'm going to now focus on is the oxalic acid. The oxalic acid. So I'm just going to go to this next page here, and I'm just going to draw my molecule of oxalic acid here. All right, COH, double bond O. There we go. Okay, so my oxalic acid here. Okay, so oxalic acid is the toxic metabolite of ethylene glycol that we really want to worry about. Oxalic acid is really good at complexing, very good at complexing with calcium. Okay, and the problem is when it complexes with calcium, it will form calcium. It will form calcium oxalate monohydrate crystals. And it forms these crystals in the renal tubules. And so, as you might guess, the life-threatening toxicity associated with ethylene glycol is going to be renal failure. It's going to be renal failure. Going to be renal failure, acute renal failure. Occasionally, you can actually have calcium depletion if you have enough complexing occurring, and occasionally you can develop hypocalcemia or decreased calcium, and you can have all of the issues associated with that. But renal failure is the really big problem. So when it comes to treating patients that have overdosed on either methanol or ethylene glycol, one thing that I want you guys to pay attention to is the fact that, let's choose this here, the fact that the ADH enzyme is one of the first enzymes involved in the metabolism of these substances. And if we can inhibit the ADH enzyme, okay, so if we can inhibit alcohol dehydrogenase, okay, if we can inhibit alcohol dehydrogenase, we can prevent the production of toxic metabolites. All right. And the specific metabolites that we're concerned about include oxalic acid when we're dealing with ethylene glycol, and the formic acid and formate ions when we're dealing with methanol overdose. So what are some ways that we can inhibit the alcohol dehydrogenase enzyme? Well, there are two primary ways. There's an old school way, and what we can do is we can administer ethanol. We can administer ethanol to our patients. We can, in essence, get them drunk, if you will, because ethanol competes. It competes with ADH. So if you flood your patient with ethanol, the ethanol is competitive, it will compete, and it will actually be interacting with ADH. And because ethanol is less toxic than the other two alcohols, we would rather be converting ethanol to its metabolites than the other two. So that's one way you can do it, is you can simply flood the body with ethanol and you can compete for the ADH enzyme. Now clearly this can be problematic because ethanol can cause neurological changes, and it can cause respiratory depression, and some negative consequences can be associated with that. There is also another way of doing that, and that is a medication that you can administer that directly competes with the enzyme and inhibits the enzyme's action. And that medication, the generic name for that medication, at least in the United States, is fomepizole. Or the trade name Antizol. Okay, so these are the primary medications that can be used. Just some other quick considerations when it comes to assessing these patients. Obviously, securing the ABCs. All right, making sure that they have a adequate fluid volume status. You may have to load them with fluids. Specific labs that you want to look at, in addition to getting a good history. Specific labs, your chemistry. Okay, your chemistry is going to be important. Running an arterial blood gas will be important. Often, because these patients are going to be in an underlying metabolic acidosis, you're going to see a partially compensated metabolic acidosis on the ABG, because your patients will be acidotic and they will be breathing deeper and faster to compensate for that underlying acidosis. So it's not uncommon to see a metabolic acidosis with a really low CO2 because the body's attempting to compensate for that. You may possibly see elevated lactate. Like I said, methanol toxicity may not present with elevated lactate. Ethylene glycol may, however. So you may or may not see elevated lactate. Another thing that may steer you toward making the diagnosis of a toxic alcohol overdose is the osmolol gap. The osmolol gap. I'm not going to spend a whole lot of time talking about how to calculate that. I've actually have videos where I've dedicated a significant amount of time into how to calculate that. But basically, what you do is you get your chemistry, and you do an analyzed, okay, gap. So whatever your analyzed gap is off your lab, okay, and you subtract that from the calculated, okay, or excuse me, yeah, you subtract the calculated from the analyzed. So your analyzed gap, not your gap, but just your analyzed osmolality, you subtract the calculated from that, and whatever that value is the gap. Your normal gap is going to be, generally, it's going to be less than about 10 to 12 milliosmoles per kilogram. The formula for calculating it is as follows. So your calculated osmolar gap is going to equal your sodium in milliequivalents per liter multiplied by 2. That's the coefficient there. You're going to add to that the glucose, and you're going to divide that by 18. and then you're going to add to that the blood urea nitrogen. You're going to divide that by 2.8. All right, and then you're going to, if you get an ethanol level, you're going to add the ethanol level divided by 4.6. This formula assumes non-SI units. So if you're in a country where you use SI units, you don't have to worry about these coefficients here. You can just use your straight units because you're not using milligrams per deciliter. Okay, so you calculate that, you subtract from the analyzed, you subtract whatever you calculate from the analyzed, and if that gap is larger than about 10 to 12, that indicates that there is some sort of substance, like a toxic alcohol perhaps, that is causing that gap. Now there's some debate over what kind of efficacy that really has. I would say that if there is any kind of history that points you towards a possible toxic alcohol ingestion, why not just get toxic alcohol levels? If you have a reasonably good lab, you can draw these toxic alcohol levels and you can find out if they're elevated or not. But the osmolol gap is a nice little tool that provides additional support for the case that you build. And perhaps maybe you're in an environment where you may not be able to get a toxic alcohol level. Then an elevated osmolol gap is more reassuring when deciding how to treat. When we talk about treatment other than the ABCs and fluids and your alcohol dehydrogenase inhibitors, you may possibly need to consider dialysis. All right, if this gets bad enough, and depending on your electrolyte imbalances, you're also going to need to manage your electrolytes, particularly calcium, in the setting of ethylene glycol overdose. Okay, guys, that was a really quick overview, but I think those are the major points when it comes to talking about ethanol or toxic alcohol, methanol, and ethylene glycol overdose. All right, guys, thanks for hanging in there. I know this was a big one to get through.